We're doing the muscles of mastication, the neck, and ocular muscles.
So, starting with the muscles of mastication, we're going to start with the temporalis, which is right here. And the action for this muscle is elevation and retraction of the mandible. And you can see the temporalis in this model as well. The masseter muscle is right here in this model. And in this model it is right there. Can you see it? Its action is to elevate and protract the mandible, and it is a prime mover or helper for jaw closure. That was weird wording, but whatever. Then the pterygoids, you have medial and lateral pterygoid. You can't really see it in that model, but the medial pterygoid is right here where this green tape is, and the lateral one, the lateral pterygoid is right here, where this tape is right here. Right, it's not that one. No, let's go this way. So the lateral and medial pterygoid. And the medial pterygoid serves to elevate and protract the mandible and helps with side-to-side movement of it. And the lateral pterygoid protracts the mandible and helps with side-to-side movement of it. And the muscles of mastication, their movement is responsible, or is due to cranial nerve V3. So, moving on to the muscles of the neck, the platysma, we went to that already. We can go back. Let's see. Platysma, you can see it there. Platysma, right there. And you can see it right there. And the origin is the fascia of the deltoid and pectoralis major muscles and acromion of scapula. The insertion point is the skin of cheek and mandible, and it acts to pull the lower lip down or tense the neck up, the platysma. You should totally model that. And there's not really a good one on the model because it's really superficial. The sternocleidomastoid is this muscle right here running up the sternocleidomastoid, and the origin is the manubrium and sternal end of the clavicle right here, and the insertion is the mastoid process right up here, and the nerve responsible for that is cranial nerve 6. I don't know if you can know that or not, but okay, the splenius capitis. Let me make sure I know where that's at. Splenius capitis is right behind the sternocleidomastoid right here. And the origin is the ligamentum nuchae. I'm not sure what that is. And the insertion is the occipital bone and mastoid process of the temporal bone. So it must be right up in here, the insertion. And it acts to turn the head to the same side and extend the neck. And the sternocleidomastoid's movement is lateral flexion. Flexes the neck, rotation of the head to the opposite side. So it allows you to turn to the opposite side, if I can swivel his head. This muscle does, the sternocleidomastoid. So the digastricus is the muscle that opens the mouth, and it depresses the mandible and elevates the hyoid bone. So when she asked the two muscles that open the mouth, is the platysma is a weak mouth opener, and the digastricus helps to depress the mouth too. So digastricus, let's find that. It's underneath here. This was the, there's two bellies of it, so I'm going to make sure that's right. The anterior belly of the digastricus is right here, and the posterior belly of the digastricus is this one right here. Can you see it clearly, Eva? Posterior belly and the anterior belly of the digastricus. That opens the mouth. So, now we have the ocular muscles. There's 6 ocular muscles, 4 rectus muscles, and 2 oblique muscles, and they aid with moving the eye in certain directions. So, for the eyeball, you have the superior rectus, the inferior rectus down here, the medial rectus, the lateral rectus. And the obliques are obviously going to be kind of on the side. This is the superior oblique right here. And the inferior oblique is kind of like this weird one that comes right down here. The inferior oblique. Now, the superior oblique makes your eye able to look kind of downwards, diagonally downwards. Your inferior oblique makes your eye able to look diagonally upward. So, the rectus muscles kind of make your eye able to look the way that they say. So the superior rectus muscle make your eye able to look up. The inferior down, the medially, and the laterally to the outside of the eye, kind of. Did you get a good view of that?
Mm-hmm.
Okay.